Today we're talking about something super important if you are planning to or if you currently live in Germany, and that's the German healthcare system. It may seem complicated at first, but once you understand the basics, it's pretty straightforward. In this video, I'll explain how healthcare works in Germany, what options are available for expats or for international students, and I'll also give you some tips to make the most of your health insurance cover. Let's get started. Germany has one of the best ranked healthcare systems in the world, and it's designed in such a way to provide universal access. Because the system is designed for universal access, it therefore means it is mandatory for anyone, meaning whether you are a student, employed, dependent, or retired, you must have health insurance in Germany. Currently, there are only two types of health insurance covers to choose from, and these are public health insurance and private health insurance. Even though these two insurances do more or less the same thing, they operate in quite different ways. Public health insurance on one hand covers majority of the residents, where companies such as DAK, TK, and AOK cover essential healthcare services such as doctor's visits, hospital stays, and prescriptions. These companies also offer subsidized rates for students up to the age of 30 years. Private health insurance, on the other hand, is an option mostly for high earners, freelancers, self-employed individuals, and anyone else who doesn't qualify for public health insurance. So now I'm sure you're wondering what the threshold amount in order to be eligible for private health insurance is. Well, as of 2025, the new limit will now be a gross annual income of €73,800 or €6,150 per month. If you've made it this far into the video, all I ask from you is to leave a like on today's episode, and if this is the first time you're seeing me, a sub to the channel would be highly appreciated. Also, if you are a current resident in Germany, kindly let me know what you think about the German healthcare system. Is it as good as people online say it is, or have you had a completely different experience? Well, in my opinion, it is very subjective and it depends on the individual. Because on one hand, public health insurance is affordable and covers most of the basic healthcare services, but one huge disadvantage is when it comes to the moment you need to see a specialist doctor. Private health insurances, on the other hand, has way more paperwork since you need to pay cash in advance in order to get treatment, file claims, and then get your money reimbursed later. But on the positive side, it is usually way easier to get appointments with specialist doctors. This is because medical practices are privately owned and they tend to prioritize patients with private healthcare since they can make more profit from them. Personally, if I had to choose, I would pick private health insurance so as not to have long waiting times to see specialists, and they usually have much cheaper monthly premiums. You don't necessarily need to do much as a foreigner to get health insurance. This is because you already applied for and were granted health insurance cover before getting your visa. All you need to do is to inform your health insurance provider when you are in the country, and the easiest way to do that is by going to the online portal of your health insurance provider, creating a profile, and updating your personal data for things such as your home address and your phone number so as to be able to receive letters from them. Trust me when I say this. This step is super important because when I arrived in Germany, I landed about 3 weeks or so after the start of the semester, and I was so focused on catching up on lectures and trying to find accommodation to the point where I completely forgot about paying for my health insurance. 6 weeks after landing, I finally found a place to live, and of course, I registered my first long-term address. A few days later, I received a letter informing me that I needed to pay about €350 for the 2 previous months plus the current month's premiums. To make things even worse, I was only given 14 days to pay since I was already more than 2 months behind on my payments. So because I had just moved to a new country and into my new house, I hadn't even had the time to open a German bank account, and I didn't have access to my blocked account money yet. This meant that I had to borrow money from friends because the last thing you want in Germany as a foreigner is to be chased by lawyers and by debt collectors. So yeah, don't be ignorant like I was. Once you confirm that you're insured, it's pretty straightforward. If you ever feel unwell, you will first need to check the availability of your house arst. This is usually done on their website, and then make the trip to their clinic during their next availability. Once you reach the clinic, you simply present your medical card after requesting to see the doctor. If, for example, you have public health insurance, your provider will be billed directly by the clinic. But if you have private health insurance, on the other hand, you will need to pay for the consultation fee and for any other tests that will be done during the consultation. After the visit, there is usually prescriptions which you will take to the apotheke, which is the pharmacy, and just like with consultations, you will either pay out of pocket if you have private health insurance, or you will pay little to no money if you're covered by public health insurance. Some of the most important tips that I always give newcomers in order to help them navigate German healthcare is, for example, as soon as you land and you begin to settle in any German city, find a house arst as early as possible, as they will be the first point of contact for any medical issues. The last thing you want to be doing when you get sick is to be forced to rush to the nearest available clinic, and maybe that doctor may not have the best reputation. Sticking to the topic of choosing doctors wisely, in case you don't speak fluent German, look for doctors who speak the languages that you do. This is where online reviews usually come in handy. Another important tip is that you cannot go directly to a specialist without a referral from your house arst. If you're moving to Germany with dependents, such as your spouse or your kids, you have to immediately add them to your health insurance plan. If, for example, you have public health insurance, your dependents are covered at no extra cost. But for private health insurance, on the other hand, each member requires a separate policy. Next, always carry your health insurance card for every doctor's visit, otherwise you might not be seen by your house arst. And lastly, always inform your health insurance provider about major changes in your life, such as completion of studies or change of jobs, as this may affect your monthly premiums. And there you have it. If you found this video helpful, don't forget to give it a thumbs up and subscribe to the channel for more insightful content. If you have any questions or topics you'd like me to cover in future videos, let me know in the comment section below, and until next time, bye!